Hello, my name is Kristen. I'm a fifth-year medical student at the Charité University Hospital in Berlin, Germany. In Germany, among complementary and alternative medicine, anthroposophical medicine, and homeopathy are the most common approaches. And I'm going to talk about how they and other concepts are implemented into our curriculum. So there are mainly two ways in which they are implemented. The first one is when the students learn about psychiatry and about psychosomatic medicine. They are introduced into the concept of a biological, a psychological, and a social dimension of health and illness. And complementary and alternative medicine is presented as a holistic approach to treat a patient with this concept in mind. So here we had seminaries and practical teachings on progressive relaxation therapy by Jacobson, on acupuncture, and also one seminary where students in little groups prepared presentations on traditional Chinese medicine, homeopathy, and anthroposophical medicine, and presented to each other those concepts to exchange and to discuss. I remember that this was rather short inside. However, it was for all students of our year, and it was also to a little extent relevant for our exams in those respective years. The second way is complementary and alternative medicine as a compulsory optional subject. So 4 times during our studies, during 4 semesters, we have to choose from approximately 8 different courses, which are all under the concept of basics of medical thinking and practicing. And so here we were able to choose, for example, homeopathy, traditional Chinese medicine, or anthroposophical medicine. And those courses allowed really deep insight. There were case studies, there were experts invited to talk about homeopathy, about cases where they applied those concepts. However, there was no exchange between the different courses. So, for example, the students who had become expert of homeopathy, for example, they didn't discuss with students who had become experts of anthroposophical medicine. And secondly, since it was optional, not all students got in touch with it. So if you were not at all interested in it, you could choose a totally different subject for your compulsory optional subject. Apart from those two ways, there were many optional offers distributed via our mailing lists of the faculty, and this were, for example, student groups meeting regularly every week to discuss and get a deeper insight. But also professionals inviting to, for example, weekly acupuncture seminaries, and there were also ways to get credits for those seminaries if you wanted to participate in those. What I've been telling right now, this is how CoAlM was implemented in the reformed curriculum at the Charité. Right now, students who start studying here, they start a different curriculum, a new one, which is called the model curriculum. And I try to find out how it is integrated into this curriculum. And obviously, it's quite the same, but a bit reduced. So also as a compulsory optional subject, which they have to do less than 4 times during the studies, they can choose a course which is called the possibilities and limitations of complementary alternative medicine, where obviously they treat different approaches and discuss. My personal insight or my personal experience is this compulsory optional subject on anthroposophical medicine that I took, and an internship at an anthroposophical hospital in Berlin. And for me, it was a very enriching experience, because I got to know cases in which the traditional approach or the traditional concept of illness and treatment is not sufficient to sufficiently treat a patient. And also because I think that there are more and more patients who ask for those concepts, and it is nice to be able to respond to those demands. Yeah, so I hope that this is helpful for your workshop, and I wish you nice and fruitful work. Bye.